Hi, I'm Dr. Walter Koroshetz. I'm the director of the National Institute of Neurological Disorders and Stroke, and I want to welcome everyone to the Nonprofit Forum. This is a really important meeting for us, and hopefully you're going to find it very helpful to you. We're here at NINDS at NIH working remotely to advance our mission, which is to understand how the brain, the nervous system works, and use that knowledge to reduce the burden of neurological disorders. But over the last year, all of us have been working from these little rectangular boxes, not squares, rectangular boxes. And, in terms of advancing our mission, it's clearly been harder to kind of connect with what it's all about, which is the patients and how to develop better treatments, figure out ways to better diagnose conditions, and reduce that burden of illness. And it's by connecting with the people on this call, on this forum, that here at NINDS, we kind of become reinvigorated from establishing those connections. So a really important meeting for us. I hope, our sense is we started this many years ago, but then we turned the table and have an executive committee of people who volunteer from nonprofits to generate the meeting and the agenda. And so the purpose of the meeting is really to provide value to people who are close to the patients in the nonprofit disease organizations. And we here at NINDS, we want to hear from you about your priorities, your concerns. That really helps us in planning what we do. And also we think, and so far, I think it's been true, that it's very helpful to you if you can learn more about how NIH operates, what are our capabilities, what are opportunities coming down the road. And clearly the message has always been that the interaction with the program directors is one of the most valuable parts of this meeting. And as people know, each of our disorders has a program director who's assigned to that area of science. And they're the ones who are overseeing the grants and the applications and working with the nonprofits to advance the science in their different disorders. So this is a chance for each of you to interact with our folks, if our folks to interact with you on a kind of one-to-one basis. And hopefully this is going to work out well on Zoom, but it's a really important part of the day. And it's also a chance, I think, for the nonprofits to network among themselves. From our viewpoint, I'm sure it's a very simplified version, but we see so many of the nonprofit organizations with pretty much similar agendas, but on different diseases. So learning from each other, I think we found, and you found, has been helpful. Before we go into it, I just want to give a kind of a high-level report about what the state of things are at NINDS. As you know, we have council meetings 3 times a year. And there I give an update with slides, and those meetings are video casted. So you want to go to the NIH videocast and search for NINDS Council. You can see them. But I just wanted to say a couple of things. One is that in terms of our research funding and evaluation of grants, none of that has slowed down at all due to COVID. It's going on with remote work as smoothly as ever. Our budget was $2.4 billion for year FY 2021. That includes particular monies for things like the Brain Initiative, which is a really amazing project I'll talk about in a second, to understand brain circuits, map them out, modulate them, model them, and monitor the brain activity that underlies what we can do as human beings. So really important work there. And the HEAL initiative, helping to end addiction long-term, has funding particularly to develop better modes of taking care of patients with pain and developing non-addictive pain therapies. And we also manage in FY20, $246 million that comes from the National Institute of Aging for what we call the Alzheimer-related dementias, and those are Lewy body degeneration, which we'll hear about, frontal temporal degeneration, Susan Dixonson's on from that group, and the vascular contribution to dementia, which occurs very commonly in people as they age, particularly if you have high blood pressure. So that's kind of our budget picture. In FY 2022, we don't have a budget yet. The president's budget did give a modest increase to NINDS and the other institutes, but there's also funding for some bigger projects, particularly in pain, and what's called Advanced Research Program, or ARPA-H, which is a potentially new center that would mimic what's done in the Defense Department, called DARPA, the Defense Advanced Research Projects. And those are very special projects, kind of have special authorities to move money quickly to generate results around a particular project. So that'll be interesting to see how that turns out. So the FY22 budget, including ARPA-H, is not yet funded by Congress. It's just in the president's budget. So we'll have to see how that goes. Our institute is divided into 3 sections. The Division of Neuroscience has most of the program directors, and there we have the program directors that are assigned to each area of science. We also have Division of Translational Research, which runs projects that will bring therapies to through the FDA process to go into patients under investigational drug or device exemption. The Division of Clinical Research, which does clinical trials. Most of our funds, about 83% of it, go to research run by the Division of Neuroscience, 8% to the Translational Research, and 9% to the Division of Clinical Research. We have a strategic plan for NINDS that's now official. It's up on our website. I would appreciate if people would take a look at it. Dr. Nina Shore, the Deputy Director, was really the driving force behind the strategic plan. And it's very different from things we did in the past. This one really has a lot of actionable items that we'll be implementing over time. And it focuses on research, of course, that's what we're all about, training, communication, and improving our workforce culture. Big components push towards improving our collaboration and partnerships. Again, this is very germane to this group. Promoting rigor and quality of the research that's done. No sloppy research allowed. And also thinking about the balance between developing team science research efforts, in addition to the heavy investigator-initiated single lab projects that we fund. A lot of emphasis on data sharing and technology development. Improving diversity in the workforce is a big goal for us. Neuroethics are programs we've just started funding neuroethics in the BRAIN initiative, and now going to expand that to our general portfolio. And then patient engagement, which we'll be talking about today. A couple of things to the future. We're very interested in upping our game and trying to reduce the disparities in healthcare in neurological disorders and kind of promoting health equity. And Richard Benson, who you'll be hearing from today, I think will be running a workshop September 22nd to 24th on this. In that aspect, our communications office has built a really amazing campaign called the Mind Your Risk campaign. And this is to try to get the message out that controlling blood pressure just has so many benefits, prevents stroke, heart attack, and probably also dementia. what we know from the science is that the message is not, it's not getting taken up as much as we would like. And people will suffer because of that. And we're going to focus this new campaign on middle-aged African-American males who turn out to have the highest risk of developing troubles due to high blood pressure. And we think that controlling the blood pressure in middle life is actually has a lot of benefit. And that's something that a message that, doesn't usually reach into this group because they, they're still young enough to feel, that any kind of medical problems are way off in the future. But if they have high blood pressure, that wear and tear on the blood vessels is doing damage for years and years. And then once you have your stroke, your heart attack, it's harder to go backwards. We are going to start a program. Again, Nina Shore is one of the drivers for this, on developing gene therapy for ultra rare disorders. So a number of the groups here might be interested in that as we roll it out. And we're hoping to develop a system where we can generate different genomic therapies very quickly and move them into patients, particularly where the pharmaceutical industries are not really involved or not interested. So today's forum, we're going to hear about COVID and the lessons learned. We're going to hear more about the value and mechanisms of improving patient engagement in the research. We'll hear about tools and resources for nonprofit groups, and also the value of early diagnosis. And as we go along, I just want to thank the executive committee for all their work putting together this great meeting. Geraldine Bliss from Koroshetz, Tish Hevel from the Brain Donor Project, Janet Heischeder from the Estonian Medical Research Foundation, Monica Weldon from SynCap Education and Research Foundation, Paul Gross from the Hydrocephalus Association and Cerebral Palsy Now, and Ron Bartek from Friedreich Ataxia Research Alliance, and Susan Dickinson from the Association for Frontotemporal Degeneration. Multiple of our program directors were also involved in working out the program, and a big hats off to Samantha White, Andrea Varela, and Jessica Corley for making it happen. So with that, I'd like to now introduce our keynote speaker. Our keynote speaker is Susan Schneider-Williams. She's an artist and an advocate for Lewy body dementia, Lewy body disease research. In 2014, her husband, Robin Williams, died, and at autopsy was found to have Lewy body disease. And she's been working amazingly hard and amazingly effective since then to raise awareness about Lewy body dementia and Lewy body disease. And as I mentioned, it's one of the disorders that we are now funding at an ever increasing rate due to the fact that funds have come to the Aging Institute that we manage for this disorder. Susan is on the board of the American Brain Foundation and has been instrumental in their new program, grant program, to improve the diagnosis of LBD, along with Michael J. Fox, the Academy of Neurology, and the Alzheimer's Association. As you'll see, her story is really poignant, and it's very valuable for us to hear. And it really, I think, moves the boat towards what we're all trying to do, is to advocate for people with neurological disorders, get them diagnosed early and treated as best possible. So with that, I'm so pleased that Susan has joined us today, and I'll give the mic over to Susan.